Hello wonderful people, welcome to my channel. Today's discussion will be the continuation of kidney disease. If you've not watched that of part 1, you can pause the video here and start from there. Let's continue. Normally, our kidney will be decreasing in its function whilst one is growing. This means that if you do not live a healthy lifestyle, you will be contributing to your early kidney damage. And people with HIV infections, because their immunity is low, they are also susceptible or easy in terms of having kidney damage or injury or diseases. We can also talk about UTI, people suffering from urinary tract infection. Because they are on the same route, there can be ascending of the infections to your kidney, which can cause injury to your kidney. Let's talk about changes or symptoms of kidney injury or disease. Remember, I said the kidney will be filtering all the unwanted ones or the waste substances out of your body and will be taking the needed one for your body sustaining. This means that if the kidney is not functioning or there is deterioration in your kidney, that action can take place and there will be buildup of those unwanted substances or the end products of the metabolic or the urea in your body. They will be accumulated, and in your internal organ or within your body, it's not only kidney which is there, we have other organs. So if although it's your kidney which has damage or is not functioning, but because all the unwanted substances are still within you, then it means it will have bad effect or there will be some consequence on those other organs. So it can be accumulated, and that build up urea or the azotemia can cause some unwell feeling because it will affect your nervous system, your brain, your spinal cord, your nerves. When I talk about nervous system, that's what I mean. So when it affects your brain, it can cause nausea. You'll be feeling nausea, and there can be sometimes even vomiting, and you'll be having some, like, you lost appetite, you can't be eating well. You being a patient, supposing you are not a medical personnel, all you know is you are now feeling some nausea, you are not able to eat. So if you do not visit the hospital and you go to maybe a nearby counter to buy drugs, all you are going to talk about is the signs. You will talk about how you vomit, how you may be not able to eat. So the person too will give you maybe appetizer so that you can eat, and anti-emetic drugs or drug which will not let you vomit, and that one too will stop. But all that will stop does not solve your problem. The main origin of all these signs, which is your kidney which is damaging, has not been solved. But if you are able to visit the hospital, there will be an investigation to know what actually is causing all that changes. That's why it is good to go to the hospital, because day in day out, while you are wasting time, then the distraction will be also increasing. So if you do not take care, you get there and things will get out of hand. So please take notes and go to the hospital the moment you see any mere changes which is not normal within you. It can cause even encephalopathy if you still stay home, like there will be distraction or abnormality of your brain, which will even then have a result in tremor of your hand or shaking of your hand. So don't waste time. In terms of the electrolytes, I talk about how it will be balancing. Because it's not working now, it can be balancing it, so there will be electrolyte abnormalities. It can be that maybe potassium will be high, or we call it hyperkalemia, and if that one happen, it will be causing cardiac arrhythmia, like your heart won't be beating normal, it will be beating abnormal. That is it. And even because within you have your heart there, that accumulated or the buildup substance can also affect the cover of your heart. We call it pericardia or pericardium. It will then cause inflammation called pericarditis. So take note of it. If so, you are there solving those mere signs and symptoms, you will still be graduating, like causing gradually you'll be destroying most of your organs. So take note. Even those activation of the vitamin D can't be also functioning. That means if you take in food containing calcium, that calcium can be absorbed, and if you have low calcium, other hormones will also be high, like parathyroid hormones. It can be high, which will then cause distraction to your bone. We call it renal osteodystrophy, like your kidney causing damage to your bone. In addition, hope you still remember discussing about kidney producing some hormones which will be helping in production of red blood cells. We call that hormones erythropoietin. Because there is deterioration in kidney function, it can have bad results in that hormones erythropoietin, decrease in production and decrease in producing of red blood cells, which will have a result called anemia on the patient. And other hormones called renin. For that hormones, there will be increase in production because of deterioration in kidney function, that hormones will be regulating your blood pressure. Because it is increased, it will also cause high blood pressure or hypertension. And remember, hypertension is having bad results on kidney, and it can cause kidney damage or disease. If care is not taken, there can be coma and death, because it will get to a stage where there will be irreversible of your kidney, like total damage of your kidney. You can't regain your kidney again. Take notes, because at that moment when you get to the hospital, the only thing we may be doing for you is first to be helping in solving those underlying causes, in case if it is hypertension or diabetes causing them, and other post infections. We have to be solving that one and puts you on dialysis to help in filtration. Dialysis is expensive. Others will go in for transplant, but transplant is more than expensive, because it will even happen you have money, but you are not getting the perfect match of your kidney, which may be delaying, and at that moment your life is at stake, and anything called death can happen. Take notes and go for checking how your kidney is functioning, or prevent yourself from unnecessary lifestyle which will cause your kidney damage. Taking much water to help in filtration. Thanks for watching. Any question you can ask at the comment section. Whatever you want to know more, you can also suggest, like, comment and share. Subscribe to my YouTube channel, Doris Opompuku, on all social media.